Hi, welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price, and I'm a physical therapist. Today, I'm going to share with you trigger point release of the pectoralis major muscle. If you have pain on your anterior chest wall or on the front of the shoulder, it can come from the pec major. Now, some of the reasons for pain in this area can be overload of lifting heavy items or using your arms in front of your body. It can be from having rounded shoulders. It can be from chronic anxiety. There is a viscerosomatic response that comes from a heart attack or a cardiac infarction that can refer pain there. So you do want to consult your medical doctor or physical therapist for differential diagnoses or to find out what may be the underlying causes of why you're having chest pain or anterior shoulder pain. But if it is from the musculoskeletal positioning of that muscle or the overuse where you've got trigger points located and then pain on that area, those can be addressed through trigger point release. And to do that, I am going to go through the origin, insertion, and then how you can release this area. So if you look where your collarbone is or feel the collarbone, the inside third of that collarbone, you're going to have the clavicular head of your pectoralis major muscle. So it's going to attach there, and then it's going to attach on the sternum, so your breastbone, and the costal cartilage, so the cartilage of the ribs 2 through 7. So it's going to be all along your anterior chest wall following the breastbone, and then it's going to insert right into the shoulder, the intertubercular groove. So that's where the long head of the biceps is. So if you find your biceps and then you can see this mark right here, that's going to be my anterior deltoid. I'm going to go under in there and follow that up into my groove, and that's going to be the insertion of the pec major. So it is going to go from the sternum over into the shoulder, and it's also attached at the collarbone or the clavicle. So it is going to internally rotate and bring the arm across the body. So I'm going to release that muscle using the size of a softball. So I'm going to use a massage ball that's about 4 3/4, so anywhere between 4 and 5 inches works well. Now I can go along and just apply pressure just to find those areas of tenderness and release that way. I like to use body weight pressure, so I'll lie onto my stomach. I'm going to go right on the inside or right on the outside of that sternum and apply pressure with my arm out to the side. So if I've got my arm in a T position where it's out to the side, now the fibers are going to go horizontal across my body. So I want to go vertical movements to go perpendicular to that. So I'm going to just use my feet to pull myself down and then push with my feet to go up so that I am going perpendicular to the fibers to release the tension over that area, as well as the trigger points. And when you're applying pressure, you may feel some of the pain refer out into the front of the shoulder. You can even have pain going into the 4th and 5th digits of the hand. So it can refer elsewhere. And you just want to spend 20 seconds to release trigger points, but I like to release up to 2 minutes so that I'm getting the fascia and the muscle to relax. And after you have released the muscle, you can then stretch the muscle. To stretch it, you can find a corner, elbows are bent. You can lean into a corner to open up the chest and to stretch that. I like to use a roller, and I will lie on the roller with my spine aligned, and I'll use weights to bring me into that chest stretch. So lining up onto my back, I can bring my arm in a T position. So I'm going to have them just straight out. I can also bend here and stretch the chest to open it, but you can start with in a T position if you're really tight in that area. Some folks have difficulty getting their hand down to the floor or even their elbows to the floor if the chest is really tight. So that's a way to stretch the muscle. Once you have stretched the muscle, to strengthen it, palms up, you can bring the arms in this direction using weight or resistance to strengthen that area. So that's how you can address the pectoralis major using trigger point release. Again, if you're having chest pain or anterior shoulder pain and it's coming from the pectoralis major, that is how you can release and stretch it to help restore the muscle tendon relationship in order to alleviate some of that pain. I hope this is of help. Have a blessed day. Thank you.